Hello, everybody. Welcome to How Learner Dashboards Created a Seat at the Medical Education Assessment Table. I am Michael Lampe. I am a program director of digital education and academic technology at the School of Dental Medicine. And I'll pass it over to Dr. Mutter. You want to introduce yourself?
Yeah. Hey, everyone. I'm Marina Mutter. I'm one of the hospitals at the University of Colorado School of Medicine. And I'll pass it on to Dr. Goop.
And hello, my name's Todd Guth. I'm an emergency physician, but also one of the course directors for our clinical skills course in our new curriculum at the University of Colorado School of Medicine. And so I just wanted to state up front that as authors, we have no disclosures or conflicts of interest, but this project was funded from a grant from the Department of Medicine at the University of Colorado School of Medicine. And so to give you a little bit of background about this project, we've started a new curriculum at the School of Medicine that really began in August of 2021. And much of the impetus behind this new curriculum is to really focus on competency-based learner education. And so within this curriculum, a really big focus was on tracking of progress of learning competencies and outcomes over time. And this is really important, not only for the students who are in the course, but also faculty, course directors, and promotion committee members who are tracking student progress over time. And so we use the conceptual framework focusing on programmatic assessment as helping to frame our project and using as a lens to sort of visualize some of the issues that we were facing when thinking about how to improve our learner outcomes tracking. And so the notion of programmatic assessment is that lots of smaller bits of assessment data might be compiled to build a more holistic picture of a learner progress over time. And so not only was it meant to show assessment of learning over time, but by having learners along with coaches or to kind of look at that with students, we also were hoping that reviewing assessment data actually promotes or is for learning when you're reviewing that with your coaches. And so the gap that we sort of were trying to tackle is that right now at the University of Colorado School of Medicine, there's no real centralized database of assessment data. And so it makes it really difficult to track progress of competencies over time. And one of the ways that we thought to be able to sort of help combat this gap was to develop a learner performance dashboard so that learners, faculty, and committee members could review easily.
And so with that, our project has three different aims, the first two of which we hope to accomplish in the first year of the grant that Dr. Guth mentioned, and the third in this upcoming year. So for our first aim, we hope to develop a programmatic assessment methodology for clinical skills for the first year medical students. And then secondarily, to actually create the clinical skills dashboard to display the results of those clinical skills assessments. And then thirdly, to actually evaluate faculty and medical student perspectives on the utility of the dashboard to promote learning and also to facilitate assessment. And so just wanted to say a few words about our project timeline. So after, this is all in the year 2021, this past year into 2022. So after receiving IRB approval, we utilized, as the reference here notes below, a process model for user-centered digital development to actually develop the dashboard. And so that included initially an alpha version and then a beta version, after which we conducted 2 rounds of low fidelity mock-up sessions, which consisted of small group sessions with students and with faculty, with 5 students and faculty in each of those, during which we actually demonstrated the dashboard and received student and faculty feedback and made additional edits in between each of those. And currently in this month, we're conducting Think Aloud sessions after making those edits from the low fidelity mock-ups, in which individual students and individual faculty members go through the dashboard from start to finish to ensure usability and to make additional minor edits as needed. And then in the second year, so 2022 through 2023, we hope to evaluate the dashboard, which consists of multiple different methods. First, we can actually monitor the usage of the dashboard. Secondarily, we hope to conduct interviews with medical students and then focus groups with faculty to determine how, if and how they're actually using the dashboard. And at the end of the year, we will distribute a survey for all first-year medical students to further ask about how they utilize the dashboard, as well as surveys to faculty members that are involved in assessment for first-year students. And then finally, we hope to actually compare the clinical skills assessment scores for a class that did have the dashboard, have access to it, and a class that did not, to see whether there are actually any differences in the clinical skills performance with the use of the dashboard.
Excellent. And so really, without further ado, now that we have talked about what this is all about and why it's being done, let's just take a really quick look at what the dashboard looks like itself. And before I get into it, just show you that, you know, this is definitely a work in progress. You know, we're always trying to find ways to make improvements of the dashboard. We started off on the left image was one of the first renditions of it before we started realizing some of the more powerful tools of Tableau and how to do things. And I'll talk about that in a second here, but let's just kind of look at where the dashboard stands right now. And so this is what a student or a faculty member going into the dashboard as it appears right now. You start off by, right now we have a de-identified number for just doing mock data so that we can explore the way we can structure things in Tableau, which is the software that we're using. So let's just pretend that we're using de-identified number 12347, and then students are measured by different outcomes, and these are the outcomes that are available right now in the Tableau system that we created. And then within those outcomes, they are measured throughout the different compasses in different cases. So one case might have, if I click on Compass 2, for example, that is actually looking at a couple of cases called Rierston and Ramos, right? So those are the way that students get measured based on outcomes, in what compass they get those outcomes measured. And then in the outcomes, there's certain categories that students hit to make up the outcome as well as a whole. So let's just pretend that this student is logging into the first time and they realize that, wow, I'm doing better in Compass 3, but you know, I didn't do so well in Compass 2. I wonder why Compass 2 is at 93%. They actually click on the Compass 2 data, and you can see this is the categories for medical documentation that were available for assessment in Compass 2. And I realized that, wow, maybe I could do a little bit better in the objective section of medical documentation. So I click on the objective section. I realize that the objective score wasn't great in the Ramos setting, and maybe I could talk to faculty over time as far as, you know, what can I do to do better in this particular section. The same thing can be done with communication. It switches up. So it's a very iterative and interactive process where students can play around with where they're at in their learning process, as well as the faculty members themselves. So with that said, I'm just going to finish up a couple of quick lessons learned. And for us, the first thing is optimizing data structure. We realized that this created a conversation both internally and outside in interdepartment conversations about what can we do to make our data more computer friendly to plug into things like Tableau, where we can actually use all the full features to be able to compare data and hit our outcomes more efficiently, effectively. And then also being able to provide a system where we're constantly revising and reviewing to make sure that the faculty and students are getting exactly what they want. And how can we make sure that happens with the team of professionals that we have working on a project like this? And last but not least, even though the main impact is visualizing data for students and faculty and stakeholders, the other side of it was being able to talk to faculty members with each other to make sure to say, okay, how do we make sure that a needs improvement score is the same with faculty member A versus a faculty member B situation? And how do we measure success in those situations as well? We were really excited about working on this project. There's a lot more that we got to do, but very excited about some of the things that we learned about to make assessment of this programming great, but also trickling that across campus as well. And before we end, we just like to thank the Tableau team at the School of Medicine, as well as the statistical support that we had as well. And last but not least, if you have any questions about what we did, feel free to email us. Our emails are on this slide. We'd be happy to field any questions that you have. Thank you so much for your time, and have a great rest of your time at Colt.